everyone, my name is Monique May. I'm going to present to you today some information about a very rare disorder. This disorder is called conversion disorder. It affects mostly women, and I'm going to go ahead and give you some brief information about the history of this disorder. It was first founded or thought about in the 19th century. There was many women who were getting this disorder. Back then, they didn't call it conversion disorder. They actually called it hysteria. Hysteria coming from the Greek word uterus. And so Sigmund Freud actually thought of that name. And because it was affecting a lot of women, it was affecting women either becoming blind or tremoring or having to do, they thought it was just because something about the uterus was making women sick, and so they called it hysteria. It wasn't until about the 20th century that it was finally named conversion disorder. It then got put in medical books so that other doctors can refer to that name if their patients were having symptoms or signs of this disorder. It was then put in the medical books. It was defined under somatoform disorders. Somatoform disorders are physiological illnesses that cause physical symptoms. And so that was then put in the books. Now I'm going to talk to you about what exactly conversion disorder is. It is a disorder where a mental or emotional crisis causes stress or produces stress that causes a physical problem. So say, for example, I'm at work and I have a really heavy stress load. I am just on the go mode all day. I go home, I have 5 kids at home. I have a husband. I have, just lost a loved one. I just changed career paths. So all the way around, I have all of these stressors that are contributing to my stress, and my body can't deal with it. My body doesn't know how to deal with it. It's having an issue trying to relax and relieve all my symptoms. Unfortunately, sometimes when your body is on a heavy overload of all these stressors, it doesn't know how to cope with all of these stressors. So sometimes this is where this disorder comes into play. And it affects some people and some people it doesn't. Sometimes it's based off of a traumatic event. Some people try to relate it to post-traumatic stress, syndrome or disorder, and it's something totally different. And so this actually is caused by stress. So you have all of these stressors, all of these things bugging you in your head, and it comes out not in anger or not crying or emotional, but it takes it out on your body, and your brain processes it differently. And so when it does that, it makes you start to have all of these symptoms of this conversion disorder. Now, what are the symptoms of this disorder? The most primary symptom of this disorder is tremoring. So for those of you who don't know what tremors are basically like convulsions or seizures. And depending on how stressed the patient is how bad that these tremors get. So for instance, for everyday, day-to-day, things that we take for granted, these people cannot do. It affects mainly people that are very healthy, very active, exercise, have a healthy diet, and unfortunately, you wouldn't think it would affect healthy people. You wouldn't think healthy people would have to get this type of disorder. But unfortunately, it does happen, it does occur. Now, it's more common in women. It is way more common in women than men. and young people. This disorder affects young people between the ages of 15 and 35. And it's usually women. Although it does affect both men and women, it's more common for young women to contract this disorder. Now, for everyday things that you and I take for granted, you or I could grab a bottle of water, for instance. This is a good example. These people could take a drink of water, no problem, put the cap on, put it down. However, when you do have this disorder and these stressors are in your brain and your brain does not know how to function, you no longer know how to pick up a water bottle and drink from it because your brain cannot process that through your body. So how we would unscrew it, take a drink, screw it back on, that's not as simple anymore for somebody that has this disorder. They are constantly shaking. Just like this. It's very difficult for them to even unscrew a bottle cap. They are constantly shaking and they cannot stop. Some doctors, when these patients go in to the hospital and they have this uncontrollable shaking or this unexplained blindness in their eyes that some of them do get because it has to do with the neurological system in your body, and they can't explain it. So a lot of doctors are thinking that these patients are faking it because they go through all of these tests, all of these MRIs, all of these CT scans, all of these neurological and blood tests, and everything comes back normal. Like I said, this affects normal human beings. However, when all of these tests come back, the doctors are absolutely clueless. They cannot pinpoint what is wrong with this patient. This patient is in pain. This patient is blind. This patient is now tremoring with seizures. This patient can't even walk. This patient can't talk. Their motor skills are not there. But yet all these tests show that this patient is 100% fine. And so for a while, the doctors could not find out, and it was very frustrating for them, and especially for the patients who, were going through this. And I read about a patient who actually, she was very active, very healthy. She was got a full ride scholarship for hockey, and she went into her freshman year for hockey, and she actually got this disorder. And one day she said she was out on the hockey on ice, and she started shaking. Her legs were shaking so bad she could not stand. She had to have somebody help her stand and walk. All of a sudden, her arms started shaking really bad. She had been under heavy amount of stress, and she said she felt like she was dying. The doctors could not give her an answer. And it broke my heart to hear that somebody so healthy went from, I'm healthy and I woke up today, to I can't walk and I don't know why and nobody else can tell me why. So it was very interesting to hear her story and hear the treatments that she went through. One thing that really got me thinking about was, how is this curable? How, since they kind of can diagnose it now, how do they treat this is what I'm thinking. And the research that I did allowed me to know that there is no cure. As of right now, there is no cure for conversion disorder. However, they can treat the symptoms. They can try to, treat the tremors and the shaking. They can try to treat, the blindness if it does occur. They can try to treat, the pain. They can try to treat, your motor skills by sending you to physical therapy. But other than that, there's no medication. There's no cure for it right now. So hopefully one day one will be found. There was another case that I read about, and the same thing. She would shake and shake and shake, and the doctors thought she was faking it too when, you know, they said that they really wanted to find out what this was. They ended up sending her to Johns Hopkins Hospital, which is a very good hospital. She then got a team of doctors such as a neurologist, a cardiologist, all the team of doctors that you could name, all the specialty doctors. They were able to actually get her to the point where she was getting a little better. She wasn't shaking as much. She wasn't, her motor skills were improving. So it usually takes anywhere about, it says 5 to 9 weeks for a patient to get the therapy they need, treat the symptoms that they have, enough to bring it down so that way they can at least control and feel like they're okay and they're not dying. And so it takes about that much amount of time in a hospital setting before they will release a patient with this disorder. And so they never know, the patients never know, the doctors, if it's going to come back. They just say to try to keep your stress level at a minimum. And I know for some of us that's awfully tough. Me, I have a lot of stressors too, and it worries me. I mean, everybody has majority the same amount of pressure on their plate, such as work, school, family, other, you know, life stressors, and we have to learn how to really deal with that. We don't want that to affect our bodies in any way. And unfortunately, this did happen to some individuals that did not, their brain could not process how to deal with so much stress going on in their lives. And it's definitely an eye-opener, and I'm so glad that I did, you know, my presentation on this. And like I said, it's very rare. It's hardly ever talked about. If you really wanted to know more information on it, it's just awesome to read about. So some of the treatments. What are the treatments? Like I said before, the treatments include talk therapy. The first patient that was a hockey player said, you know, they asked her, what happens to you if you feel a tremor coming on and if you feel like you're going to have a convulsion? What do you do? How do you deal with that? How does your brain process that? And she goes, well, I can feel it coming on. I can feel it because you know your body. Everybody knows their body, and everybody knows when something's wrong or when something is going to happen. And so she said, I know my body. When I know that I'm going to get one of these, I lay down, I scream, I call for my mom or my girlfriend in the room, and I lay down and I just rest. And I just rest and I just close my eyes and I try not to think about it. And if it's really bothering me, I will talk about it immediately. I'll start talking about whatever's on my mind at that given point, and I will talk about it, and I will try to release as much stress as I can. And that seems to help. And so with that, she said, over time, it'll go away. And so it's amazing how these people can cope with this without any treatment and how they know how to deal with it. I hope in the future they find a cure. My heart goes out to all the patients that do have this disorder. I, being a patient, I have lupus, and so I can't really compare the two. They're very different. But it has to do with neurology and rheumatology, definitely two doctors that I do see also, and I could just relate to what, you know, they're going through. They're young, they're lost, you know, and nobody's really telling them, you know, when there's going to be a cure or if there's ever going to be one, and so you just have to be on edge with it. And like I said, my heart goes out to all the people that have this unfortunate disorder, and I'm really glad I did it on this, and I hope that anybody learning or listening or watching this video really takes it in. And, you know, being healthy, you know, you can't take it for granted, because you or I can drink from a cup, remember this, and some people can't even put it to their mouth. Think about it. So thank you very much, and I am very blessed to be as healthy as I am and talking to you right now, because remember, some people can't do that. Thank you.